Do carrots help you see in the dark? Is turning orange from carrots dangerous? Why do all vitamin A products warn about pregnancy? Do vitamin A in skincare work? Should I take a supplement containing vitamin A, and can multiple ones be dangerous? I will answer these questions and more in this video. There will be timestamps and references in the description box below, but before I start on the content, here are my disclaimers. I'm Eloise, I'm a UK Pharmacist for 20 years, and I'm passionate about clear, accurate information on medicines and supplements that everyone can understand. The information I provide is for educational information only and is my own opinion. However, I do my best to base it on the most up-to-date evidence. Always contact your own healthcare professional for your own individual advice on your own personal situation. Before I talk about the supplements and the potential problems with taking too much of them, we first need to discuss why vitamin A is an essential vitamin and how we get this in our diet. So vitamin A is a fat-soluble vitamin essential for all animals, including humans, right from the formation in the embryo to our immune systems, as well as our skin and eyes, and it can help modulate over 500 different genes. It's actually a group of chemical agents that include retinol, retinaldehyde, and retinoic acid. We can consume the active version of vitamin A, known as the retinol or the retinal, from oily fish and from animal organs such as liver, as well as dairy products and eggs. We can also consume the precursor of vitamin A, known as the pro-vitamin A carotenoids, that can be turned into vitamin A by our bodies. These are found in fruits and vegetables and other plant-based products. The most common being beta carotene from carrots, sweet potatoes, mangoes, and apricots, and it is the beta carotene in them that gives them the orange colour. So vitamin A deficiency is very rare in developed countries, as most people get enough vitamin A from their foods that they eat, and it is added to many breakfast cereals to help prevent deficiency in children. However, vitamin A deficiency can occur in premature babies, those people with cystic fibrosis, Crohn's disease, ulcerative colitis, and celiac disease. So a common sign for vitamin A deficiency is an eye condition called xerophthalmia. Xerophthalmia is the inability to see in low light, and it can eventually lead to blindness if it isn't treated. And long-term deficiency of vitamin A can also lead to a higher risk of respiratory diseases such as pneumonia and infections such as measles. And it also can cause anemia in severe cases, and in extreme circumstances, getting enough vitamin A can increase your chances of dying. So that's why vitamin A is an essential vitamin for us. Do you take supplements containing vitamin A? Please comment below if you do and if you think they are useful. You will often find that when you look at multivitamins, they quote 100% RDA against most vitamins and minerals, but that vitamin A, it's usually only written at 25 or 50%. So bear that in mind for when we move on to the dangers and toxicity of vitamin A later on in the video. RDA stands for Recommended Dietary Allowance, and it's the average daily of dietary intake sufficient to meet the nutrient requirements for 98% of healthy individuals in a particular age bracket and gender. So vitamin A supplements usually contain either the active form of vitamin A as retinol acetate or retinol palmitate, or the precursor form of vitamin A such as beta carotene, or sometimes even a combination as both. So when it's recorded on the ingredients list, it's usually then written as retinol activity equivalents, or REA, so that you know how much it's actually going to convert into the body of actual retinol. So I'll provide a list here. So the recommended dietary allowances for men and women is usually between about 700 to 900 retinol activity equivalents a day, respectively. Obviously, children require a lower amount, and people that are pregnancy and breastfeeding may require a slightly higher amount, but they shouldn't exceed that. So, and the towable upper intake level in adults is usually set at around 3,000 retinol activity equivalents a day. But we'll go on to the dangers and the upper limits later on in the video. So, as I mentioned previously, the usual reason for requiring vitamin A supplementations are conditions that prevent its absorption from the diet, such as those with cystic fibrosis, Crohn's, ulcerative colitis, and celiac disease. There is also an interaction that can happen with some weight loss medication that prevent the body absorbing oils and fats, which then in turn stops the absorption of fat soluble vitamins. This is medications such as orlistat, which is also known as Xenical. So supplements are also quite often given to young babies and infants, especially those born premature, to prevent issues in their early development. And in developing countries where vitamin deficiency is common, children, when they catch diseases such as measles, are more likely to have severe symptoms and die from the disease. So there is a call for trying to ensure that people and children in third world countries have access to vitamin supplements that also contains vitamin A to help lower the risk of their chance of dying from measles and other infective diseases that are still prevalent there. Another area where vitamin A and its precursors have been studied extensively is in age-related macular degeneration, and this is a type of vision loss where the centre part of the vision deteriorates and is the most common cause of vision loss in older people. And they have done studies on supplements containing vitamins such as A, C, and E, as well as with zinc and copper, and then also with beta carotene and other carotinoids such as lutein and zeaxanthin, to try and see if they can reduce the progression of AMD. Two big studies, the AREDS and the AREDS2, did find that there is a reduction in the progression from intermediate to advanced AMD by taking these supplements, although they don't actually prevent the original onset of AMD. And they don't provide any benefit on cataracts. And the same benefit can't be found from just the omega-3 fatty acid supplements from fish oils. There was found to be a slight risk that beta carotene itself can increase the risk of lung cancer, but when they substituted the beta carotene for the lutein and zeaxanthin carotenoids, that increased risk wasn't seen. So this is one area, if you are at risk and if you discuss it with your ophthalmologist, that it may be of worth taking some of these supplements, obviously within the recommended daily allowance. Obviously, going on from that, there's been observational studies for years that have shown that people who eat lots of foods that are rich in vitamin A and beta carotenoids, as well as other plant-based foods, are at a lower risk of certain types of cancer. So they have done studies to try and see if that vitamin A and the beta carotenoid supplements can help prevent cancer or lower the chances of dying from cancer. However, it did seem to backfire, and as already alluded to, sometimes, especially for those that have smoked or used to smoke, actually high doses of beta carotenoid supplements can actually increase the risk of lung cancer and death. So really, rather than taking it as supplements, the benefits from vitamin A and beta carotenoids are best as part of a healthy, balanced diet. So, vitamin A in supplements and in topical products for skincare. So, vitamin A and retinol is essential for the epithelial cell production in the skin and the health of the skin and in maintaining collagen. There has been extensive research on retinol, and its derivatives such as tretinoin, isotretinoin, and adapalene, and these have been very much proven to help with skin conditions from acne, rosacea through to psoriasis. And then, as a side effect of the decades of research into those conditions, they've also found that it helps in the reduction of fine lines and wrinkles, and it's now extensively used in the beauty industry as well. However, I'm not going to go into a deep dive on this because there is a wealth of other YouTubers out there that have already covered this. And the main ones I'm going to recommend is Michelle from Lab Muffin Beauty Science, Rob from Mad About Skin, as well as dermatologists such as Dr. Dre, Dr. Sam Bunting, and Dr. Shireen Address. However, do be aware that if you are using the retinol and the retinol over the counter, you may have some side effects as you start using it of dry skin and purging as you get used to it. And especially when you come on to the stronger agents such as the tretinoin, and even if you end up taking the oral prescription only isotretinoin, that you need to be under the care of a dermatologist for these so that you can have it titrated up slowly, being aware of the risk of the side effects and have them reviewed on a regular basis. So, but there is a wealth of other information there over on YouTube for you to look at. On to the main section, the dangers of vitamin A. All types of vitamin A, including the carotenoids, are fat soluble and they can be stored in fat tissue as well as in the liver. And as a result, they can accumulate over time. So the carotenoids can deposit under the skin and cause an orange colour. And then especially the retinaldehyde and the retinoic products can build up in the liver. Acute toxicity can happen within a day, and symptoms can include blurred vision, nausea, vomiting, dizziness, and a headache from increased pressure in the skull. Chronic toxicity may occur over months of long-term consumption of vitamin A supplements. And when combined with alcohol, that threshold is lower because it has a similar sort of acetaldehyde formation in the liver, and your liver can only cope with metabolizing so much of both of them. So the symptoms of vitamin A toxicity starts off as dry, tough skin that can start to crack, as well as dry mucous membranes such as the lips and mouth. And this is also one of the side effects that can happen when the prescription tretinoin and isotretinoin is used, and that's why it's always best that this is done under the supervision of a dermatologist. But moving on from that, the symptoms can then of further toxicity can be cause dry hair and then alopecia with the falling out of hair. Can move on to having liver abnormalities as the liver struggles to process and metabolize the retinol out of your system, leading to fatigue, muscle weakness, and then bone weakness and the risk of fractures, especially in older people. So that's generally the main risks of the toxicity. However, the main warnings with vitamin A is for pregnant women. So vitamin A is essential for the embryo to grow and for the expression of over 500 different genes as the embryo is growing and developing. However, there is a very delicate balance in there, and if ingested in larger amounts, the vitamin A can become teratogenic, and teratogenic is the medical term for potentially causing birth defects. This is most likely to happen during the first trimester and up to week 12, and it can result in malformed skulls, faces, limbs, eyes, and the central nervous system. So in pregnancy, although you may need to take a pregnancy multivitamin, which you will require for the folic acid, which helps prevent neural tube defects, you need to be careful that it is a pregnancy multivitamin and you don't try and take any other vitamins at the same time that's going to add to the vitamin A overload. So as you will probably notice, most non-pregnancy vitamins and supplements like fish oils that do happen to contain vitamin A will have a warning on them for not to be used in pregnancy and for you to seek the advice of your healthcare professional so that you know exactly what you're taking over all your supplements so that you don't overdose on the vitamin A. You also will find that the retinoid derivatives that are used in skincare, even applied topically on the skin, will still have that warning on them for use in pregnancy. And that's because we don't know exactly how much is going to be absorbed through the skin, and whether in combination with the supplements that you're already taking orally into your system, you definitely don't want to be causing any sort of increased risk to your growing baby. So the first documented vitamin A toxicity was back in the 16th century, and this was when Arctic explorers ate seals and polar bear livers while they were there. That was the food that they had available to them. But further up the food chain, animals do retain the retinol in their livers, and when it comes to the seals and the polar bears, the amount in there is very highly concentrated. However, there shouldn't be any problems with us eating any liver or pate in our diets, because from the animals that we have, the retinol concentrations isn't that high, but it is still recommended that pregnant women and even older people with reduced bone density shouldn't go and have too much liver or pate, and probably just have it once a week, and just as an infrequent basis. So the adverse effects of both the acute and the chronic toxicity of vitamin A can be reversed after its consumption, and the symptoms can resolve within a few weeks. Unfortunately, that is not the case for the birth defects, and that's why you do need to take the warnings within pregnancy seriously. And finally, onto the questions about carrots. Do they help you see in the dark, and can they turn you orange? Yes, so carrots do contain beta carotene, which the body then can convert into the active form of vitamin A. Therefore, all the important functions of vitamin A, including eye health, seeing at a low light, and seeing colour that I previously talked about, will be achieved from having a balanced diet containing carrots. However, they won't make you magically see any better in the actual dark, just improve your actual overall eye health. However, carrots can turn you orange. It's the beta carotene that gives carrots their vibrant orange colour, and eating too many of them will result in this being stored in the fat layer of your skin, giving your skin a yellowy orange colour. And this is actually called carotenemia, and is most obvious on the palms of the hands and the soles of the feet. And it can be differentiated from the yellow of jaundice from liver issues, as the whites of the eyes will remain white. So the orange from carotenemia is completely harmless, as the body is not converting the carotene into the more active and toxic forms of vitamin A as retinol, as the body is able to regulate this conversion and it won't poison itself. So the treatment is to have a low carotene diet. So take those carrots out your diet, and it can take several months for the skin to return to its normal colour, as your body will metabolize the carotene into retinol as it's needed and then used up. Although substituting the carrots with tomatoes will just cause a similar skin discoloration called lycopenia, as it contains a non-vitamin A carotinoid called lycopene that again is a shocking yellow-orange colour but is harmless. So thank you for watching. If you have got this far, please comment of whether you prefer carrots or tomatoes. If you found this video interesting, please like and subscribe so that the YouTube algorithm will share this video and that you'll be able to see my future videos. I will have 2 of my previous videos linked for you here, and I welcome all my new subscribers as well as all my returning viewers. So please comment if you have any questions that you have and any ideas for future videos. And I will just show you that my cat has been off screen trying to get attention. So this is Nobby, and I'm sure he will make an appearance in future videos as well. So thank you for watching.